Hi, I'm Dr. Steve Vargo, optometric practice management consultant with IDOC, and I have here with me Dr. Brian Lynch. Dr. Lynch is an IDOC member, and he's also owner of Branford Optometric Associates in North Branford, Connecticut. And Dr. Lynch is also involved with some legislation in his state. It's a consumer protection bill called House Bill 6012. That is designed to require people who get a contact lens prescription online to have a valid prescription. So welcome, Brian. Thank you for joining us.
Welcome, Steve.
For a few minutes. And yeah, if I could, just curious if you could tell us a little bit about what's going on in your state with the legislation that you're involved with.
Well, the bill actually was a little bit more than what you described it. House Bill 6012, an act protecting consumers in eye care, was designed to require a patient to have an in-person evaluation associated with receiving either an initial contact lens prescription or a refill of a contact lens prescription. The Connecticut legislature has passed this, and it's been enacted into law. It went through our public health committee. First step at 23-3, I believe, was the vote. 24-3, correct. 141-0 in the House and 36-0 in the House, and then was signed shortly afterwards by the governor into law. And the law will become effective in October of 2017, so just a couple months from now. Basically, as I said, the legislature was concerned about contact lens prescriptions and online providers not being able to provide the level of care mandated by our current telemedicine statutes. Our current telemedicine statutes in Connecticut require that a provider, whether remote or in person, provide the same level of care, that the provider online have access to a patient's medical record, and that there be no difference in the level of care that one would receive in person versus online, and the same liabilities attached to both to the provider. Those who opposed the bill were not able to convince the legislature that they had the technology to provide that level of care that an in-person evaluation provides remotely. Despite their hardest efforts, and we did meet up with some pretty heavy hitters as far as opposition goes. 1-800 Simple Contacts, what do they call them? Opternative.
Mm-hmm.
As well as some other online vendors, all hired government relations providers or government relations consultants to defeat this bill. They were unsuccessful, and it was simply because they couldn't convince legislators that this could be done remotely at this point in time. They tried to paint optometrists in the state of Connecticut and the Connecticut Association of Optometrists, as well as the State Medical Society and the Connecticut Society of Eye Physicians, who all work collectively on this. They tried to convince the legislatures that we were anti-technology, and again, we're unable to do it. That the legislators, I think, took a very prudent position on this. I think it was a wise decision, well thought out, to say, look, you just can't do a contact lens evaluation via a selfie.
Mm-hmm.
That's the technology that they're claiming to have, and that it's supposedly as good as you placing your patient in front of a slit lamp and evaluating the way a contact lens fits and the health of the cornea.
Mm-hmm. You know, not a lot of things surprise me anymore. I'm not surprised this technology exists, and I'm really not even surprised that you can have a glasses prescription filled off an online refraction. I don't like it, but I'm not surprised by it. But what's always surprised me is that the ability to get a contact lens prescription filled off of an online refraction. To me, that just seems like somebody's not paying attention that you can do that. I'm curious, and maybe you've already answered this with the overwhelming vote in your favor, but were the legislators surprised by this? Or did that take a lot of education on your part to inform them of the same thing that you and I know already? But I think we both know there's a lot of public misperception out there about what's all involved, certainly with a glasses exam, but especially with a contact lens exam.
Absolutely, and I think it became evident right out of the get-go. When we were at our public health committee, the CEO of Simple Contacts got up to testify, and she had gone on and on and on about the technology that Simple Contacts has and how they can evaluate a contact lens. Well, no online refraction was done. The patient simply punched in their contact lens numbers off the boxes of the lenses they have at home. They took a selfie that somebody reviewed remotely, and that was beginning and end. A provider who's licensed in the state just signed off on the script, but only after the patient had also said that they were going to hold the provider harmless for any liability attached to it.
Mm-hmm.
It was so blatantly against what we demand of our providers who are providing any sort of care remotely. They couldn't convince the legislators. As in my testimony, I stood up and I said, here it is, folks. This is their technology. We all have one, and it can't work remotely. It doesn't do it. It doesn't effectively evaluate a patient's corneas and contact lenses.
Yeah.
So they were completely incapable of convincing the legislators that they could. And that was the downfall. The technology's just not there to do this safely. When the opposition to the bill came back and said, well, you know what, it's just contact lenses. There's no harm, no foul. The CDC report that came out in 2014, where they reviewed all of the literature or all of the claims associated with contact lens wear back in 2010, and saw the financial impact of complications associated with corneal issues, corneal ulcers, keratitis, etc. How much it cost Medicare, how much it cost Medicaid, what it cost the healthcare system. It became obvious that contact lenses aren't the same as glasses. And that's the distinction our legislature made, in that they felt as though contact lenses were a different animal. Doing an online refraction, I agree with you, Steve. I'm not a fan. I don't believe it can be done effectively, but the position our legislators took, right or wrong, was no harm, no foul. At the end of it, if you have an examination online and you end up with a pair of glasses you can't see with, is the patient's eye health at risk? And that was something we couldn't prove. Legislators agreed to us that, yeah, patients are being misled to believe that they're getting an examination. And so many of the patients who come through our offices, think of an eye examination as a refraction. And they miss out on, not that it's not being provided, they just are not focused on it. They're not paying attention to the eye health part of the examination. They just want to know, why do their glasses not work? And we go through the refraction, and we do a pressure check, and we dilate, and we look at the fundus, and we do the comprehensive exam. But at the end of the day, your patient wants to know their glasses are okay and their eyes are healthy if they're educated enough. I believe a lot of these sites exploit the ignorance of a consumer and say, look, we can do an online exam. And you and I both know that's not an online exam. I don't know how they can effectively do a refraction remotely, but it's out there. And our legislators didn't see any harm in online refractions, but did truly see contact lenses as a different animal, and that harm could be done here.
Mm-hmm. Yeah, I was talking with somebody else involved with legislation in a different state, and one of the things that they mentioned, I was curious what kind of pushback they got, and one of the things they mentioned was a concern over legislation that would halt or stifle the progression of technology. So if it's okay, I'll quote you for a second on something from the Harvard grant. Telemedicine can provide critical access to quality of eye care when it works well. And that's interesting. And I think we both agree. I mean, technology is going to change. Eye care has to adapt. Telemedicine is going to become more common. That certainly the healthcare delivery model is going to continue to change. That's, I think, poses a real or perceived threat to a lot of ODs, but there's also a lot of opportunities there as well. So what we're talking about here, I think, is technology that, from our concern and the public's concern, is not an acceptable substitute for a contact lens exam. So certainly there's issues around that. But if we put that to the side for a second, where do you see things moving in the future? What kind of opportunities? Because I hear a lot about the threats and the concerns and the sky is falling, but some technology, it's going to change, it's going to adapt. Where do you see that going, and what are the opportunities that some of this creates for ODs in the years ahead?
Well, you know, I'm not a big thinker on this issue. Certainly, I will agree with you that technology will change. I don't believe that technology will change solely for online sellers of contact lenses, because that's what a lot of these sites are. They're using their website to give a pseudo exam, if you would, so that they can sell patients more contacts. And I don't even think that's a form of telemedicine. To my point, and my quote in the Current, I think that telemedicine currently has its limits. The limits aren't just to, or the advantages aren't just to websites, but may also be to practitioners like yourself and myself. At this point in time, you know, we can use a cell phone to do an evaluation of a patient's red eye, not as well as with a slit lamp. If that patient, and I'll share a personal case, a patient who's been a long-time patient of mine, called up at the office, student out in California. I'm here in Connecticut. Dr. Lynch, I've got a red eye, non-contact lens wearer. I said, yep, it looks a little red. I was able to chat with them a little bit. I had access to their medical record and said, look, I'm going to call something in for you based on what I've seen. And I felt comfortable doing that. So called in something, and you will get back to me within a couple days to let me know how you're doing. The individual did just fine. It worked out great. And that was pretty much the limits of our telemedicine now, day-to-day patient care. We know that fundus examinations or photos are being reviewed remotely, just like x-rays are. My sister is an x-ray tech at a local hospital here, and she'll tell me when there's no radiologists on staff, they have Australian radiologists reviewing x-rays from a hospital here in Middletown, Connecticut. And she goes, it's a great system. So our ability to physically examine a patient is limited by technology now. At least physically evaluate a patient remotely is limited by the technology. Will there be something that can snap on to your iPhone and will be able to then get a better view of a pair of corneas and maybe do a refraction? Will there be something that you can put into your Samsung 3D virtual reality glasses at some point in time and be able to do an evaluation remotely? I'd be foolish if we said no, but those opportunities are going to exist for online providers as well as the individual practitioner. So I remember in one of my testimonies, I had said, why do you think this is just about practitioners versus online providers? Don't you think I'd love to be able to do examinations from the comfort of my living room? But the technology isn't there to support that level of care that our patients deserve, and a level of care that can be safely administered. And that's where the argument of the online suppliers of contacts just fell apart. They just couldn't come back with an answer to that.
Yeah. I mean, it'll certainly be interesting going forward. 10 years from now, who knows what they're going to look like. The other side of the opportunities is the threat side, and I think that's where ODs lose more sleep over. I'm curious, aside from legislation that you're involved with, because obviously that's one way to to tackle some of these threats is to get involved, like yourself. But how do you get involved with your patients? What do you do, and what would you suggest to other ODs as far as just educating and informing patients on the difference between the two? Because we can make an impact there, and maybe even redirecting somebody who's thinking is maybe going down a path that you think is not in their best interest.
I think you have to do it one patient at a time, Steve. Having seen the deep pockets of those people who oppose this legislation, there's no way that you can run a media campaign that can combat their media campaign. They were just relentless, and it was very apparent we were being outgunned financially here in Connecticut. So we took one legislator at a time and educated them as to what kind of level of care a patient gets personally versus remotely. I think that providers, I know we all have busy days, but I think if providers are talking with patients about what it is they're actually doing, explaining each test that they go through, by counseling them on how to protect the health of their eyes going forward, I think then the chips fall where they may. We certainly can point out the errors of that patient's ways, who comes in and who's gotten a remote refraction, they can't see with their glasses, and I'll sort of give them a little jab here or there. Say, well, what did you think? You were trying to do this remotely. You can't do it that way.
Yeah.
And they go, well, yeah, Dr. Lynch, it wasn't anything like the exam you gave me. I looked at a couple screens. I had to hold my credit card up. I walked back a certain number.
At some point, wouldn't you think this isn't the same thing?
Well, yeah, when they ask you what your shoe size is, and then they say, okay, now go heel to toe until you get to this distance. Yeah, I think some back away from it, but the lure of convenience. We all have very busy lives, and some people just believe, well, if it's online, it must be okay. And that's where we have to educate our patients as to the value and the service that we provide them.
Yeah, yeah. To me, a lot of this has always been a perception issue. And like the example that you're giving is maybe that patient had a perception that it was the same thing. And perception is reality, right? And you use the word exploit, and I certainly think we both have seen situations where the advertising around this was perhaps a bit misleading. From a legislation standpoint, as a means of getting in front of that, do you think there'll be more legislation? Because I know your state's involved, and I know there's 11 or 12 other states involved. And I'm just curious, based on your experience, do you think we'll make headway in legislation across more states and momentum will be built up around the laws?
My hope is that it will. And I think Connecticut's law was very, very focused, and it was common sense that there was no way you could argue that you could do a contact lens evaluation remotely. Now, we as providers, as you know, are already required by law to hand our patients a prescription for contact lenses and glasses at the closure of an examination. That's part of the Fairness in Contact Lens Consumer Act. And I believe that was passed about 2 decades ago. Patients are entitled to it. They're entitled to purchase their products wherever they want. And that's their right, and I respect that. At the same token, these online suppliers, if you look at what their intention is, they've targeted into convenience. Pull up Simple Contact's website. Skip the doc is what's written right across the top. It's obvious what their motive is. Their motive is just to sell contacts at the end of the day. So it goes back to that old adage, if it sounds too good to be true, it usually is. And if it sounds that great, you can just go online and you can get an eye examination, and it's just as good as your doctor's. And you can go online and then just click over to ordering your contact lenses. Sounds too good to be true, it usually is.
Mm-hmm. I would agree. So I did a similar interview with Dr. Michael Zolman, who has similar legislation going on in South Carolina. And when I was driving home after that and thinking about what I was going to ask you, what really occurred to me is, I wanted to ask is, how does the average OD get involved with this? If not at the same level that you're involved, if not directly with legislation, I think there's a perception amongst the community that there's sort of this David versus Goliath scenario going on, and there's nothing we can do. Whatever's going to happen is going to happen. But I think that's not the right way to look at it. So I'm curious, how does the average OD get involved? Who do you call? Who do you email? And how do we collectively make a difference?
Well, I sort of digressed in the last question, didn't really answer it, and I don't want you to think I'm a politician. But my point with regard, you had asked first, other states, do I see more coming down the road? Yes, I do. I think that you will see more legislation and more legislation attached to contact lenses as well as eyeglasses, but I think they're going to get separated, to tell you the truth. I think that legislators will start to think very much like ours did in Connecticut, that no harm, no foul on a refraction. There'll probably be some more restraints with regard to claims you can make online as to the level of care you can give. We have several Warby Parker outlets in the area. They were involved in this battle too. And their design is to set up remote refractive devices so that patients can then go into a remote refractive device, maybe in one of their brick and mortar stores, which are here, and then somebody else is signing off on the scripts. As you and I both know, an autorefractor doesn't really even a refraction, but it is what it is. So I do believe you're going to see more and more states. I think you're going to see legislators across the country look at laws like ours that are common sense as sort of a pause button to say, look, the technology hasn't caught up. They're right. So let's put a pause on this, as Connecticut did, and said, you can't do this remotely, but we'll reopen this when the technology catches up. To your second question with regard to how do you get involved, well, that's a hot button here for me. Every OD, when you sign on as an OD, you realize that you are in a legislated profession, and I will give this lecture to my members here in Connecticut, where we're in a box. You're in a legislative box. You can go this far to the left, this far to the right, this far north, this far south, and that box is very strongly delineated by every state's scope of practice. What you can and can't do is infringed upon by OMDs, by insurance companies, etc. We want to expand, they want to contain. We are a legislative profession, and the only way in which you can advocate for your profession is in the legislative arena. Now, how do you get involved? Well, first of all, find out who your legislative chairman is within the state that you live in, okay? And ask them, how do I get involved? You should also establish a relationship with your local legislator. You mentioned David versus Goliath. What was a key factor for us was our grassroots efforts. We attached to every legislator an OD. The OD sat down with them, talked with them, expressed their concerns as a provider within their community, taking care of that legislator's constituents. You're absolutely right. 1-800, simple contacts, they can outspend us. They're all funded by venture capitalists. They're big bucks, deep pockets. We can't match that. But when there's a relationship between a legislator and a local practitioner caring for their constituents, that legislator has a certain level of trust within the individual, and that trust goes a long way. When I spoke to legislators very calmly, consistently, factually, without any aggrandizing, they got it. They understood, and they respected that. They realized that the hired guns that came in, the multiple lobbyists for the various venture capital funded companies, they realized they were just hired guns. That was it. That's not the guy or gal who's working in my backyard. So having that relationship, and a relationship that's cultivated over time, is critical. That if you show up at your legislator's door the day you have the ask, it doesn't work. Where were you 2 years ago when they were running, for that local campaign and having a spaghetti dinner? Pay the $20, go to the spaghetti dinner, shake hands with them, invite them into your office. The picture that's being painted of your profession by those who are not fond of it is one of, you're nothing but an eyeglass maker. You prescribe glasses. They don't know that we're treating glaucoma. They don't know that we're co-managing cataract surgery and LASIK surgery. They don't know that we've got prescriptive authority for all orals, all topicals in the state. And when you educate them to the level of what you can do, it's really a revelation for them.
Yeah.
Would you rather define your scope? Who would you rather have defining your scope of practice? You as an OD or an OMD? I'd rather inform my legislators what I can do and what I can't do.
Mm-hmm.
Anybody else?
Yeah, me too. That's an interesting perspective, that once you sign on as an OD, you enter a legislative profession. And I think that's an interesting perspective. And if more people saw it that way, and maybe that will start to change, hopefully we'll see more momentum with people getting involved, because the other alternative is to not do anything and let things evolve around you. Brian, this was really interesting. Thank you so much for taking some time out of your evening. And thank you for your efforts in Connecticut, and keep up the great work. And please keep us posted on any changes, any advancements. We're happy to have you out there fighting the good fight, as they say.
Thank you for giving me the opportunity to chat with you, Stephen. I hope you have a lovely evening.
Have a great evening. Thank you.
Bye-bye.